The messaging for breast, prostate, and cervical cancer screening, I think, could be drastically improved to encourage people that early detection saves lives. A lot of times people think what they don't know won't hurt them, and that's just not true. And one of the things that I think is important while we encourage people to get screened is to understand that there are disparities and differences in the ages that African Americans are diagnosed with cancer and the rest of the society. So, where getting screened for breast, prostate, and cervical cancer at 50 or 60 years old, the national recommendation may be appropriate for the majority of the country, looking at screenings specifically for African Americans starting at age 30 or 35 may be more appropriate. And there are a lot of advocacy groups in the African American community who are boots on the ground, seeing these diagnoses at very early ages. And I'm currently 40 years old, and I know several of my peers who have already passed from cancer and who have already faced some very devastating cancer diagnoses. So I think it's important for us to advocate for earlier screenings and earlier testing for African Americans specifically because of the earlier ages of diagnosis.